So when we talk about diagnosing prostate cancer, the biopsy is, well, it's the gold standard, right? But here's the thing. What if the way we've been doing it for decades isn't the only way? Or maybe not even the safest? Today, we're going to dive into the two main paths doctors can take, and you'll see it's a pretty fascinating story of how an old idea is making a huge comeback.
All right, so here's the core challenge. You get an initial test back, like a PSA blood test, and it shows a potential risk. Now what? Well, doctors need to get a direct look. The whole goal is to take a tiny, tiny piece of the prostate tissue to analyze it. But the real question is, what's the best and safest way to actually get there?
And that's exactly what we're focusing on. Because it's not just about if a sample is taken, it's all about how. You see, the specific path that needle takes, it has major implications, not just for accuracy, but also for patient safety. And that's a big deal.
Okay, so this whole process is obviously a crucial step. Let's break down the two main techniques doctors are using to get that all-important tissue sample.
A good way to think about it is like having two different doors into the same room. Both get you inside, but they take completely different routes to do it. Same goal here, get a prostate sample.
So let's get into let's call it the basic geography. The most common method you'll see is the transrectal approach. That's where a needle passes directly through the wall of the rectum. The alternative? That's the transperineal route. It goes through a patch of skin called the perineum. Now, this second method is way less common today, and this is the interesting part, it's actually the original technique.
And yeah, that history is pretty surprising, right? The transperineal approach, it's not new at all. It was actually the first method used like a century ago. The transrectal way of doing things only became the so-called gold standard back in the 1950s. So why on earth are we now looking back at this older technique?
Well, it really comes down to this essential trade-off. We've got to compare these two methods on the two things that matter most. Number one, how well do they actually find cancer? And number two, how safe are they for the patient? Okay, so this is the million-dollar question when it comes to diagnosis, right? Does one of these methods actually have a clear edge in sniffing out cancerous tissue? You know, when you actually dig into the research, the evidence is, well, it's kind of a mixed bag. Most studies, they find no significant difference in cancer detection rates. A couple of them do hint at a slight edge for the transperineal route, but the bottom line is pretty clear. There's no slam dunk winner here when it comes to detection alone. And that brings us to the second factor, which honestly might be the more decisive one. I mean, if the detection rates are pretty much the same, then suddenly safety and complications become a huge deal.
Okay, now this is where the transperineal approach has a clear, decisive advantage. Just think about it for a second. The needle never passes through the rectum. That means you're avoiding the risk of dragging bacteria from the bowel straight into the prostate. It's just a cleaner, more sterile procedure by its very design. And the data? It totally confirms this theory. In most studies looking at transperineal biopsies, the rate of fever, which is a key sign of an infection after the procedure, is somewhere between 0 and 1%. Just 0 to 1%. That incredibly low number is probably the single most powerful argument for its safety. So, let's put all this together. What's the final takeaway from all the research?
There's a quote from the source paper that really sums it up perfectly. It basically says that the transperineal approach is safe, and yeah, it's effective, but it hasn't so far resulted in higher detection rates than the transrectal biopsies. So, despite having a really strong rationale, the evidence just isn't there yet to prove it's definitively better at finding cancer. It's a really nuanced conclusion.
So as we start to wrap this up, it's pretty cool to look at the journey here. Medical practice started with the transperineal route, right? Then it shifted to the transrectal. And now, because there's such a big focus on safety, we're seeing this renewed interest in that very first original technique. It's a really fascinating cycle when you think about it.
And that leaves us with a really fascinating question, doesn't it? In this constant search for better, safer medicine, could the very first approach, the one developed 100 years ago, actually be the future of prostate diagnosis? It just goes to show you, sometimes the best path forward is one we've known about all along.